Voice. Okay, okay. Now is it better? Okay, okay. Fine, fine. So, let's start with the presentation. Okay. So, today the session is about PGDRP, and the full form is Postgraduate Diploma in Rehabilitation Psychology. Now, in this presentation, we'll talk about what, why, and how. So, what actually is PGDRP? And so let's start on with it. About me, I'm myself a licensed psychologist. I've been practicing, or you can say, in this field for the past 24 years now. I started on with teaching psychology in universities, and then later on, I started practicing on my own. Now, okay, yeah. So now let's talk about why, what is actually PGDRP. So PGDRP in very short and simple terms is actually a 1 year course. Right? I think someone wants to join. Just let me come back to the slide. Okay. Yeah. Good evening, Mira. So okay, let me come back to the slide. So postgraduate diploma. Yeah. Good evening. No, 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 no. I just started on, and Dr. Shashi will also be joining in a few minutes. Right. So I started on with what actually is PGDRP. So PGDRP means Postgraduate Diploma in Rehabilitation Psychology. Now, why it is 1 year? Because it's a diploma course. And so diploma means is no less than a degree because here it's actually it this course gives us a practicing license, right? And it is a full-time course, but the universities have uh, given us the opportunity that working professionals are in fact doing the course. Why? Because the university uh, is giving relaxations in terms of attendance. What happens is that we take the online classes, so it's actually a regular mode where the students need to attend the classes regularly, going to the college or to the university. But since the demand is there. That is why some universities have open up in the sense that they give the attendance based on the on our online classes. Right? So that's a mutual agreement and arrangement between us and the universities. Right? And next important thing is approval. Uh, I'll just show you the list. Let me show you the list also. Is it visible to all of you? But it's quite, I'll say, not that big. I'll share the list uh, with all the people over there. So this is the list. If I go to the top of the list, what actually it is a list of approved institutions. Right? I'll just scale it up. Yeah. So as you can see, this is the list of approved institutions. This is up to 29/10/2025. So whenever you go to the website of Rehabilitation Council of India, you will have this updated list every time. Now this list has shown that these and these institutions are approved to provide that particular course. Now, when we do this particular course, called as the PGDRP, the 1 year course, when we submit the documents to Rehabilitation Council of India, which is a government body situated at Qutub Institution area in New Delhi, then they issue a license. Now, how to? does that license look? Let me see if I have something of that license. I'll show you that license also. Fine. And these are the kind of notifications given by Rehabilitation Council of India from time to time. According to these notifications, they have changed the existing the course curriculum patterns like MPhil clinical psychology and MPhil rehabilitation psychology are no more in existence. Instead of them, they have brought up M MSc clinical psychology, MSc rehabilitation psychology. Fine. So these are the notifications given by RCI from time to time, and so that we are it's aware that which particular course is going to continue or not. Now, why PGDRP becomes more important nowadays? Because MPhil rehabilitation psychology is gone, and now the next process is they are asking for a curriculum for MA in rehabilitation psychology. So there are very high chances that coming next year, you won't have a 1 year PGDRP. Maybe it will be uh, changed to a 2 year PGDRP, or it will be scrapped completely. But that does not mean that if when it is scrapped, then the previous PGDRPs are not considered. They will always remain in place. For example, those who have done MPhil clinical psychology, MPhil rehab psychology, their license remain valid throughout. But the only thing you need to do after a gap of 5 years or 7 years, depending on the course, is to have accumulate those 100 CRE points. Right? So what PGDRP is a 1 year course which gives us the license to practice as a psychologist. Okay. So course structure is as given in the website of Rehabilitation Council of India. The course structure is the same throughout the country, and the core subjects would include the assessment part as well as the different disabilities. Right? So rehabilitation actually means bringing back to normal. So someone who has deviated from the normal paradigm defined by WHO, we rehabilitate them to the normal society. Right? Now, when you talk about the standard in syllabus or given by RCI, so there is no confusion at all in terms of any of the university or college. Their teaching methodologies may vary, their examination time may vary, their practical date and duration may vary, but the course subject remains the same. As per the mandatory requirement, minimum 75% attendance is mandatory. Right? We'll talk about that also. Now, what are the key benefits? In short, is a license to you. When I talk about license to practice as a psychologist, I like to remind that even those who are into property consultancy, for them also there is a license called as RERA license, because all the RERA approved authorities they only permit a RERA license holder property consultant to deal in their transactions. Right? So as we see that the whole world is shifting toward licensing, right? And the sooner you have, the more convenient it will be. Because as and when you get late in acquiring that license, the structure becomes more stringent. Fine. So one key benefit is you have a license, you have the authority, your document is valid throughout the courts in India. Fine. So if you give a certification to anyone, that certification is valid because you are a license holder. Now, next thing is it gives you the practical skills. Internship is mandatory in PGDRP, as in masters also in psychology. Fine. And then when we talk about the career opportunities, not means not only in terms of job, but also in terms of when you practice as a psychologist, it gives you the edge, right? Okay, okay. Dr. Shashi has also joined. Okay, and I'll reshare. Good evening, Dr. Shashi. Welcome to session. Yeah. So I'll just complete the presentation and then we can have the Q&A sessions where your feedback would be very much beneficial. And just- Sure. Right. Oh, okay. Right. 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 So I'll just finish with the presentation and then we can quickly shift to the Q&A round so that we meet our purpose as early as possible without any lecture. Fine. Okay. So these are the opportunities. You also get into a professional network. So all the licensed psychologists, they have a own professional network, and then you get more knowledge, experience, and opportunities to work across various places. Right. So curriculum highlight again, I'd say a technical one, but not difficult. If you have interest in psychology, so you get to know about the assessment because I get a lot of queries like, how about MPhil clinical psychology? How about clinical psychology and rehab psychology? Can I do the assessment? Yes, you can do the assessment because you're reading about the assessment, you're learning about the assessment over here. You get to know about the different kinds of psychometric tests which are used. Plus, also, you are learning about rehabilitation techniques, whether it is educational, vocational, or social. Fine. And when I talk about special population, nowadays people are themselves identifying that there are many issues in their life, and then they go to a psychologist and get themselves assessed. And I see a large number of neurodivergent population coming up, and they really need help. Right? That's why, and moreover, when in such a turbulent and turmoil scenarios like the Iran war, so more and more, I'll say there will be a need for more and more licensed professionals, more and more professionals. When I talk about the eligibility criteria, very simple, masters or bachelors. Even if you have a bachelor's in psychology, you can go for PGDRP. Masters, 55% is required. Fine. So the admission process, selection process, there is no entrance examination. There is a direct admission to the universities. Main issue is that uh, when we get late, we miss the university which are giving us better opportunities to learn. Fine. Though the admissions keep on going, but as and when we delay, what happens is that the university fees goes high and then you delay this time and then the examination would be delayed, so you get the license by August. Now suppose if we start now, then there is a good probability that by next year May you have completed the examination and you have submitted your documents for license process. Fine. So yeah, fine. Okay. So let me stop the presentation over here and let us come back to the session. Okay. So now the foremost important point is why actually we need a license, because there is a lot of contemplation discussion going on LinkedIn, and where people say is that okay, I can do counseling without a license. Now, there are two issues. One is that according to the rules, if you are doing a counseling, you need the observership of a licensed psychologist. That is one issue, which is very important. Second thing is, if you're doing counseling and if you are giving a, a written instruction to the client, then you need to give it on your letterhead. Fine. And if you're a licensed, then it gives you a better authority. Actually, it gives you the authority. Otherwise, whatever you say, do, and write, anyone can challenge that, and everyone can challenge the license over there. Right? So, yeah, I'll invite Dr. Shashi to share her experience with us, and then how was the process? How was the coordination with the university, which really helped us her in doing and completing the whole process. Yeah, no worries. Yeah, yes, ma'am. Yes, yes. You're visible. Yeah, yeah, sure. Yes, ma'am. Yeah, yeah. Please go ahead. Yeah, 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 yeah. Yes, ma'am. Audible. Yeah, yeah. You can mention that because now we are connected with almost 4, 5 different universities. Yeah, yeah, you're saying. Yeah. Thank you, Dr. Shashi, for sharing your feedback, and thank you for a positive feedback, I will say. And in fact, the other student also, they have just written the examination of home studying, and the the other two universities, they are still in the process. Uh, so so uh, what I will say in the end is like uh, what our purpose is to weed out the agents which are coming into the education industry without a commitment and without a know-how. And I'm sure that we all have met, we all came across such agents who are only admission agents. So they give you the admission and then they run away. Right? So nobody takes the responsibilities. Whereas we, on the other hand, being educationists, being psychologists ourselves, we want that the people should get the right kind of approach, the right kind of connections, the right kind of networking, and the right kind of knowledge. Even in the online classes which we conduct, um, we take up the real life cases. So we give the case presentation, we give the case discussion to our clients, and Meera ma'am is quite aware that uh, there are practical cases which we deal. So as and when you come into practice and when you deal with the real life cases, you don't feel alien into that profession. So you have some know-how, you have some a wider practical knowledge because knowledge in the books, I'll be sorry to say that knowledge in the books is still limited. So we are still in the process of updation. So though our software gets updated very fast, but it's unfortunate the books which we have as curriculum, they get updated very slow. That is a sad part. The main focus of our organization, connaissance specialist, connaissance is actually French word which means knowledge. So our main focus is to fill this gap, right? So even there are other colleges also where you can take admission and you can do the whole process, but it it is a real thing that you don't get the right knowledge over there, right? You don't get the real connect over there. So thank you, Dr. Mishra, for your time and yeah, yeah. Oh, great. Yeah, right. Yeah, Meera ma'am. Uh, yeah, Thank you. Thank you, ma'am. Dave, you can also write on the chat box. I think network issue is there. Sure, sure. Thank you. Right. So, uh, this usually happens with most of the professionals. Yeah, yeah, Dave, please ask your question. Right. Hmm. Right. Hmm. Hmm. Yeah, what we do is we conduct online classes and the timings are almost the same, 7:38, as per the convenience of the batches. Because if we talk about the current batches, seven students from Home Sterling and 11 students from two different universities, they all did attended the same online classes, and they're all from different places. Three students from Chennai, one from Guwahati, and two from Bangalore. So they are all from different places. Uh, in and the online classes we do is as per your convenience, as per your timings, and they are recorded also. So like one of the student, Dilip, he is into in defense. Um, so he hardly gets time sometimes because of his posting in remote areas. And so we have arranged recorded classes also. But usually we prefer the student attend the online classes. So timings can be as per the convenience. So all these, when I talk about, all of us are working professionals. So the university is giving us this leverage that we do the online classes, we send the attendance to the universities, and the attendance issue is handled by that. And so different universities vary in their norms. Like some universities, they don't even call for a practical examination, but Home Sterling will they call you for the practical examination, and you have to go at least 3 or 4 times there. But other universities, we talk about universities in Rajasthan, Jaipur, Dausa, they don't need, they don't require your attendance in between. So you can directly go at the end of the semester, write those four papers, and then you're free. Yeah, I hope this suffices your questions. Yes, ma'am, please. Actually, what I'll say, ma'am, yeah, yeah, very true. What I'll say, ma'am, is that the problem is, hmm. So one day I'll come to your center. It's in Odisha, no? Yeah, yeah, definitely. Sure. Yeah. So I was actually telling that paid internship would have been more better if the knowledge gap was not there, because the students who are coming there having the knowledge from the books, and the right therapy books are still not there in this in India, particularly if I say. So they only have general psychology or clinical psychology book, but not books on therapy, and not even taught in the master's or bachelor's courses. So you have only clinical psychology as a subject. They're talking about the issues. They're not talking about how to tackle them, how to solve them, how to go ahead with the therapies for the client. Yeah, right. Sure. So I think it's time to wrap up this session. Yeah, yeah. Mhm, mm, mm. Yeah, if you look at the course, I'll say if you go through the course, it's very extensive. And if you read the details of that one, you'll get a good knowledge of that one. And when we do the internship in the NGOs, then that helps a lot, because then you really understand the clear-cut difference between rehabilitation and clinical. I'll say clinical people are uh, they fantasize about being a clinical psychologist, but in reality, as a rehabilitation psychologist, you get the extreme divergent cases. And clinical is only talking about, okay, if I have some issues which I feel is not normal to the whole thing. If I have depression, insomnia, and all those things which are on the extreme higher end, fine, then I'll go to a clinical psychologist. But the rehabilitation psychologist starts from the beginning. Fine. If you have any issues which you're not able to adjust, then the work of the rehabilitation starts first. They rehabilitate you to the normal society. And what I have seen, what I've been observing in real life scenario is that in neurodivergent groups also, you see the scenario is very bad over here in India. In neurodivergent groups also, they are still looking for good psychologists. Why? Because the role of psychiatrist over here is to only give medicines, but medicines only has never rehabilitated anyone, even with high blood pressure. Doctors are also taking medicines for a higher blood pressure. Fine. And the problem is that dosage never ends. That dosage keeps on continuing and increasing, even for the drug addiction cases, even for all other problems. So it's actually when you take the medicines, you create a base, right? But to build a castle or build a building or bring back to the normal life, you need a psychotherapeutic method. Right. And what I've seen in neurodivergent like populations, they have now, I joined one or two groups, the neurodivergent people. Now I am a part of six neurodivergent people. Now, every month we have a meeting and then the cases. And I will say, I mean, I will invite you guys also. Why don't you attend and have that meeting where you will have the real cases and you get to know how they are dealing with the problems, day-to-day problems in their life. And it's really enriching. Even I have doctors who are coming into that group. They're understanding, they're learning about how this population works. So it's actually, if you are in between the affected population, you get to know better in that way. And of course, license is something which adds to the credibility. And yes, that says what I feel is a community outreach program which I have. So we usually have it in some nice place in Delhi. This month itself we had a meeting on seventh or eighth. That was in CR Park. So in that meeting, all the things are discussed. Like even we play games and all those things. So. Um, it really helps us to know in a deeper manner that what actually goes behind a neurodivergent mind. And now one next thing which I am like building up is the transgender group, because they are also part of the society. Now they also need rehabilitation. So as a rehabilitation professional, you can reach to any sphere. And but and the thing which people are fantasizing clinical one is clinical is the thing where you get the cases only when the things completely go out of hand or mostly go out of the hand. Right? So if they say that catch them young. If the problem is there, the sooner you catch it, the sooner you are able to identify, and I think you can solve it. Yeah. So yeah, yeah, please. Okay. Mm. Uh, Diploma in child counseling, does it give RCI license? Because in the RCI website and list, it's not mentioned over there. Yeah, there is another diploma, which is there, but the seats for that is very less because very few institutions are offering this diploma, I'd say. Yes, NIPSED is giving, but that is not RCI recognized. It is giving a diploma in child counseling. Mhm, mhm, Mhm. Mhm. Okay, okay, okay. Sure, sure. Yeah, yeah, yeah. Jamia has, but whether it is RCI license or not, that is a question. Okay. Yeah, that is the issue. Similarly, as you have diploma in clinical psychology. See, I'll say just recently the the norms have been changed. Now the distance courses in psychology, as per the rules, won't exist from most probably next year onwards. Fine. So this year onwards, I'll say if you take up any course and do up the things, it will be beneficial because the as and when the regulations are changing next year, then then you can take admission. If PGDRP is there, you can take admission in that one, or else you can take admission in masters in uh, uh, clinical psychology or masters in rehabilitation psychology. That would be a 2 year, but clinical psychology would require a regular attendance, as the MPhil did already. And the yes, the fee structure for that one is very high as compared to the PGDRP one. Like PGDRP one, you can do it around 1.6 at the max, fine, or 1.7. But MA in clinical psychology or MA rehabilitation psychology is almost, I'd say, 5 to 6 lakhs. So that is a problematic thing because MPhil, even regular MPhil clinical psychology was not that costly, except for few government universities themselves, like National Forensic Science University in Gujarat. It is also very costly. Even MPhil over there is very costly. So either you go into higher studies, I would say, if you have interest, but that would be mostly academic in nature. Or if you want to go into practicing side and a higher study also, then you can go for PhD in no, that is PSYD. That is not PhD. That is PSYD. PSYD and PhD is a different thing. PSYD is PsyD, they call this in short, is related to your practicing PhD in clinical area. So you have to go and do the things over there. And the difference is that it's a 6 year course. So the shortest course, which gives you the license to practice, is PGDRP. Or then the next one, or you can do something in child counseling, as ma'am just said. And apart from that, I'll say then if you want the academic fervor also, you can go for a PhD in psychology after doing your diploma. Because with me and ma'am, it happened that we did our PhD and then we enrolled ourselves into an RCI license course. Fine. And so that gives us I'll say when you have done when you have done your doctorate, then again you are entering into a course and then you sitting like a student feels a little different. So I'll say if you want to pursue a course, get a license and do a higher studies also based on your interest. And it's not necessary, and there is nothing, I'll say in most of the places there is a distinction that People are asking, do you give PhD in clinical psychology? I'll say it basically, PhD basically is a research work. It is your topic, which is your subject, which is your title, which defines whether it is a clinical or non-clinical one. Of course, the there is the nomenclature PhD clinical psychology is wrong. It is actually either PhD or PSYD, which gives you the uh, command on it. Yeah. So yes, you can see as yeah, please, man, please. No, I've done. I've done. Yeah. Yes. In fact, I'll say it reminds me. Yes, Dev. Yeah. Mhm. Mhm. Yeah, 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 yeah. We are offering internship. In fact, all our students, along with their online classes, they got the real cases. In fact, we are focusing more on real cases internship, and uh, I'll say we also know that marriage counseling cases are are a lot over there because if marriage counseling is not done well, there ultimately the legal counseling steps in, right? And in fact, I'll say is um, we all need to identify, as ma'am has just rightly said, we all need to identify the area with which we dealt with and became perfect. Like it can be relationship issue, it can be anxiety, it can be exam phobia, it can be fear of future, fear of failure, fine, and sleeplessness. As I know, many people were working outside India. Now they when they enter into like in Gulf, what happens is that the time period is like you have to go to the university at 7 a.m. in the morning. So most of the people from India who are working in government jobs and then enter into that stream, they had this anxiety. What happens if I could not sleep? If I don't get early in the morning, and they had the habit of sleeping late in the night. So insomnia is a growing problem nowadays. So if now the point is, if you want to practice as a psychologist, you have to identify your core strength, your core areas in which you become expert in dealing. And that can be through the internship, yes, of course. And then second thing is reading the right kind of books. Like we in our internship, we focus on books. My focus is basically on books which are not available in the market, but which are related to therapies. And these are specialized books. So it is a right time when we get exposed ourselves to specialized book. Even there is a book which I have not completed it yet. It's a book on, I've shared with most of the students also dealing with ADHD, adult ADHD issues. It's growing now very fast. People are identifying as I said, neurodivergent population. So how do you actually treat them? How do you plan a timetable for them? And how do you plan the interaction of these people? So it's actually taking the role of a mentor as well as a psychologist. So only psychologist role won't be that much effective because people here need guidance. And the problem is that due to many people posing themselves as a psychologist. Why license again? Why it is important? I'll say because many people are entering into this field and they are bringing their own baggages. But the point is that yes, we psychology is acceptable to all the fields, but it has to be a systematic process altogether. Yeah. Yes. Yeah. Very good. As per the demand, it was hybrid, but now it's mostly online. So now I have students not only from counseling and clinical field, but also from HR and OB. I have students from Hyderabad also who are with whom I am focusing because I have done my net and doctorate in management also. So it's an extensive part, but psychology terms leadership and other issues in psychology are totally different from leadership and other issues in management. So here we are dealing with the psychological aspect of leadership. Sure, sure. Thank you. Thank you very much for your time. Okay, okay. Sure. Mm, right. Sure, definitely. I'll share on the WhatsApp all the details. Right, right, right. Because most of the admissions they start up and even close by this month. Mhm. Right. See, you get admission, you take admission to the college, and then your course starts, and then you in between you have your practicals. So, and then at the end of the year, you have your examination. It depends from university to university. Some have semester system, some have yearly system. So when you then you submit, then you pass, when you clear your examination, and then you submit, and the your 60% is the passing marks for that one, minimum one. And then you submit your documents to Rehabilitation Council of India, fine. And then they give you a temporary license immediately. And when you submit the documents, and this also includes certificate of completion and attendance uh, given by the university, and as well as the internship certificate, which the internship, uh, like we give the internship certificate to the students. And you submit this report and these documents, all those things to RCI. It gives you a temporary license. And then after a gap of, I think, 1 month, or depending on uh, the waiting list and the criteria, you get the license, which is the permanent license, and which is earlier, which was valid for 5 years. Now uh, it is valid for 7 years. So you have a good amount of 7 years to accumulate these 100 CRE points. The 100 CRE points is that we are also conducting the CRE sessions, CRE webinars, and even you can, we'll call you to conduct your own CRE sessions, so that you gain those 100 CRE points easily within a span of these years. And so this is how the things continue. Yeah. I'll share all the details in the WhatsApp. Sure. 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 Okay, then I'll wrap up the meeting. Okay. Thank you. Thank you everyone for joining. You're welcome.